Hi, I'm Dr. Joe Nelson, and today I'll be discussing the APGAR score. The APGAR score is the universal language of newborn assessment and resuscitation. Named after Virginia APGAR, a pioneering anesthesiologist who created the score in 1952, it is also its own abbreviation. There are 5 domains to score the newborn, with 0, 1, or 2 points awarded for a maximum possible score of 10, although few newborns achieve a 10. The score is given at 1 and 5 minutes of life in nearly all newborns, with some also recording an additional score at 10 minutes if resuscitative measures are taken. The actual values for this score are pretty intuitive and easy to figure out once you understand what a normal newborn should look and act like, and can remember what APGAR actually stands for. The 5 domains of APGAR are appearance, pulse rate, grimace, activity, and respiration. Let's talk about what these words actually mean and how to score a hypothetical newborn. We'll work from what an ideal newborn would be, scoring a 2 on each domain, to what would be concerning for a 0 score. 1 will always be somewhere in between. So, let's dive in. A for appearance, meaning the color of the newborn. A newborn's skin ought to be pink throughout, regardless of race or ethnicity. 2 points would be awarded if the skin is pink everywhere. 0 points would be awarded for a newborn that is blue or pale skin throughout the body, and 1 point for somewhere in between, with blue skin on the extremities and pink on the head and trunk. This is called acrocyanosis and is what almost all newborns actually look like at the 1 minute mark. Next, P stands for pulse rate. 0 on this score indicates a pulseless newborn. 1 indicates a detectable pulse with a heart rate less than 100 beats per minute, and 2 for a pulse of 100 or more. G stands for grimace or reflex irritability. Newborns are irritable little guys. They've just been through quite an ordeal and ought to cry with stimulation. Crying lands a newborn with a score of 2, while grimacing only with stimulation gives it a 1, and no response to stimulation at all gives it a 0. The second A stands for activity, or how much they move or resist movement. A newborn that is actively moving, or at least resists extension of its limbs, lands at a score of 2. 0 points are given if the infant does not move or resist movement of its limbs at all. A 1 indicates flexed limbs that are easily extended without resistance. Finally, R stands for respiration. We give babies double points for a strong cry, as that means it is moving air well without problems. A 0 indicates no respiratory effort at all, while a 1 once again is somewhere in the middle, with slow or irregular gasping. With that, we've concluded our short review of the APGAR score. Remember, a score of 10 indicates a perfect newborn who needs no resuscitation and can go straight to the breast, while a 0 would be a pulseless blue inactive newborn who does not move or breathe. Nearly all land somewhere in the middle. Its simplicity and ease of use is likely why it's been in practice for so long, and also why you'll be able to nail this assessment the next time you need it. Take care.